Hello, I'm Diana Galata, Director of Communication Services for Prince William County Schools, and today I am speaking with Ms. Teresa Polk, who is our Supervisor of Student Health Services. Good morning.
Good morning, Mrs. Galata.
So, this is a really difficult time, obviously, with the pandemic, but we in Prince William County Schools have this unique situation, and thankfully during a pandemic, of having a school nurse in each school. Talk to us about the value add of that, especially during a pandemic.
Okay, yes, it is very important that we have a nurse in every building because the nurses have that unique ability because of their education and their experience and background to be able to see students and do an assessment on those students and make a decision about whether that child needs to go home, whether the child needs to stay in school, or whether or not it might be more of an emergency situation. All of our nurses are highly trained. They're all registered nurses. And we are just so thankful to Dr. Waltz and the school board for understanding and having that vision to understand the reason for having a full-time nurse in every building. So right now we have a little over 100 nurses. So we have a full-time nurse in all of our schools, and we have some nurses who are part-time, and they provide services if one of the nurses is out one day, or sometimes we send them to a school to support a nurse, because not all of the schools, particularly the high schools, have clinic aides. So, the schools are very busy. There's a lot going on. And even though right now we have a limited number of students in school, there's still a lot of work that needs to be done to prepare for students who are going to be returning in the future. The school nurses certainly assist families with resources. They work very closely with the school counselors, with the social workers, and they are part of the team. And so we are just excited about our nurses. They are very, very highly charged group, and they're ready to jump in and tackle almost anything. And in fact, one of the things I'm very proud of is that we have a public health committee, and we formed that committee once we started dealing with the COVID-19 situation to assist myself and Mrs. Bellamy, who is the coordinator, with trying to provide some guidance for the nurses as well as some guidance for school staff in managing the kids that they will be seeing during this particular time. Many of the nurses that are part of that committee have a public health background, so that's an added plus. And we're just very proud of the fact that we've got an awesome group of nurses who are very committed to making a difference in helping students achieve.
Well, Mrs. Polk, thank you very much for helping us better understand what they're doing during this difficult time. Thank you.
You're welcome.